Healthcare staff have faced many challenges over the past few years, working under very difficult conditions during the COVID-19 pandemic, and the country is indebted to you. COVID-19 is still with us, but thankfully we have excellent vaccines which are protecting people from serious illness. Unfortunately, further waves of COVID-19 infections are expected. Mask wearing and hand sanitising remain important tools in our fight against infection. I urge all healthcare staff to avail of the COVID-19 booster vaccine at a clinic near you to ensure you are protected. Times and dates of clinics are being circulated via email, or ask your line manager for details. This winter, a second very serious challenge faces us. There is a strong possibility we will have a bad flu season. For the past 2 years, the flu season was disrupted across the globe because of the lockdowns and other measures taken to control the COVID-19 pandemic. Now we are returning to normal life, and as a result, the winter bugs are emerging in force. We need to protect ourselves, our children, our elderly relatives and friends, pregnant women and those vulnerable people who have issues. The best way to protect each other is through vaccination. Flu is a very serious illness. Sadly, we know that some people never recover to their full health after a flu illness. Flu vaccination clinics are already being rolled out in the HSE clinics, pharmacies and GP surgeries. Again, times and dates of the clinics are being circulated via email, or please ask your line manager for details. Please make sure you book an appointment now for yourself, your elderly relatives, your children and for family members who need to be protected. The flu vaccine is safe. The vaccine is free to you and to the at-risk group. Thank you for getting your COVID-19 booster and flu vaccines this winter. I'd now like to introduce Dr. Anya McNamara, Area Director of Public Health, who will explain the importance of getting your vaccinations.
Research has shown that healthcare workers are up to 10 times more likely to get infected with influenza than the general population. Every year, 1 in 5 healthcare staff become infected with flu. This means that you can spread infection to your colleagues, to your patients, and bring it to your family at home. We know that influenza can cause a very severe illness in the elderly, in people with chronic conditions such as heart and lung disease, in young children and in pregnant women. The COVID vaccine doesn't prevent you from getting influenza because COVID-19 and influenza are caused by 2 different viruses. The influenza vaccine is a safe, effective vaccine which we know reduces the risk of you becoming infected with influenza, avoiding hospitalisation and reducing flu-related deaths.